Wait, wait. Are you telling me that my neighbor's daily 15-minute walk could actually be leading her straight to a wheelchair?
Yes, doctor. Before we continue, I need to confess something to our listeners. I fell into this trap myself. I used to think my 20-minute morning walks were keeping me healthy. But after our conversation last week, I started to realize I might have been fooling myself. How does that happen?
Look, that's a question that should be asked in every doctor's office in the country, but it's not. What happens is simple, but devastating. After age 30, we lose between 3% and 8% of our muscle mass per decade. After 50, that loss speeds up dramatically. If you're not doing exercises that actually challenge your muscles, and I mean really challenge them, you're basically watching your strength and independence go down the drain.
Wait, exercises that challenge the muscles? My doctor always told me that walking was enough. Was she wrong?
Not exactly wrong, but incomplete. And that's the part that makes me furious with our current healthcare system. Walking is great for cardiovascular health, sure. But when it comes to preventing sarcopenia, which is age-related muscle loss, and especially for maintaining bone density, light walking isn't enough. It's like trying to put out a fire with an eyedropper.
Sarcopenia? That's a term most people have never heard, right? But they should.
It should be front-page news. Sarcopenia is literally the difference between living independently into your 90s or needing help getting out of bed at 70. And you know what really infuriates me? There's a study from Harvard University that tracked over 100,000 people for 2 decades. The results are shocking.
Shocking how?
People who only did low-intensity exercises, light walks, gentle yoga, pool exercises without resistance, had nearly the same rate of muscle loss as people who were completely sedentary. You heard that right, the same rate. They were exercising, sweating, dedicating time for nothing, worse than nothing, because they were building a false sense of security.
That's disturbing. So you're saying millions of people are wasting their time on exercises that do nothing?
Not nothing, but very little when it comes to preserving what really matters: functional strength and bone density. And here's the crucial point no one wants to say out loud. The fitness industry makes billions selling the idea that light exercises are enough for seniors. It's more comfortable, less intimidating, easier to market.
Are you suggesting there's a conspiracy to keep seniors weak?
I don't use the word conspiracy lightly, but I'll be direct. There's a very clear economic interest in keeping people dependent. Think about it: wheelchairs, walkers, osteoporosis medications, hip surgeries, nursing homes. We're talking about a $1 trillion industry. How much money gets lost if 70-year-olds stay strong and independent?
That gives me chills. But how do we know if we're stuck in this disguised sedentary lifestyle trap?
Excellent question. Let me give you a few red flag signs. First, can you get up from a chair without using your hands? If you hesitated, we already have a problem. Second, can you carry 2 grocery bags to your car without feeling like you're going to pass out? Third, can you climb 2 flights of stairs without getting out of breath?
Well, maybe not as easily as I should. And I imagine many listeners are having the same uncomfortable realization right now.
And they should, because these are basic functional strength tests. If you fail them, your exercise routine isn't working. And here's what worries me the most. I had a 68-year-old patient, extremely active, according to her. Walked every day, did water aerobics 3 times a week, came to my office because she was struggling to open pickle jars.
And what did the tests reveal?
Bone density of an 85-year-old, muscle mass 40% below normal for her age. In other words, all those gentle exercises weren't protecting her bones or muscles. She had been working out for years, just to say weak.
That's terrifying. How is that even possible?
Because bones and muscles only respond to stress. It's called Wolff's Law. Bones get stronger only when subjected to load and impact. Muscles grow only when forced to work against progressive resistance. A light walk might get your heart rate up, but it won't create the stress needed to keep bones and muscles strong.
So we've been lied to for decades about what really works.
Not just lied to, we've been conditioned to accept frailty as inevitable. It's normal for your age, they say. Take it easy, they recommend. Don't push too hard, they warn. All of this is a recipe for early dependence. And you know what's most criminal? It works. People over 50 can and should be stronger than most young people today.
Stronger than young people? That sounds impossible.
It only sounds that way because we've accepted a lie. I have 75-year-old patients who lift more weight than their 25-year-old grandkids. The difference is, they understood that muscles don't have a retirement age. But they only got to that point after wasting years on useless exercises, thinking they were taking care of themselves.
What do you mean by useless exercises? Can you be more specific?
Absolutely. That senior dance class where you barely lift your feet off the ground? Useless for strength. That strength training with half a kilo weights that you lift 20 times without feeling anything? Useless. That treadmill walk where you can hold a casual conversation the whole time? Useless for bone density. You're spending time, energy, and money just speeding up your own decline.
But we've always been told that intense exercise is dangerous for seniors. How do we reconcile that?
That's the biggest lie perpetuated by today's medical system. You know what's dangerous? Being weak. Do you know how many people die each year from falls? Over 36,000 Americans. And do you know the main cause of those falls? Lack of leg strength and poor balance. Intense exercise prevents falls. Gentle exercise guarantees them.
Do you have data to back this up?
I have studies that should be on the front page of every medical journal. An Australian study tracked over 1,200 women over 65 for 5 years. They split them into two groups. One did, quote, low-impact, safe exercises, the kind recommended in 90% of senior fitness programs. The other group did progressive strength training and controlled high-impact exercises.
And what was the difference?
The, quote, safe exercise group had 67% more fractures than the intense training group. Let that sink in. The exercises that were supposed to protect them were actually destroying their bones. And I'm not talking about some obscure study. This was published in the Journal of Bone and Mineral Research.
This goes against everything we've heard for years. Why isn't this public knowledge?
Because public knowledge doesn't generate profit. A strong person doesn't need as many medications, doesn't need support equipment, doesn't need special care. A weak person feeds an entire industry. And look, I'm not saying all professionals are malicious, but many are simply repeating what they learned decades ago, without ever questioning it.
So what exactly should we do? Because now I'm genuinely worried that my entire exercise routine might be completely useless.
First thing, stop lying to yourself. If you can do an exercise for more than 15 reps without feeling real discomfort in your muscles, that exercise isn't saving your independence. It's just wasting your time. Second, your bones need impact. That means exercises where your feet hit the ground with force, where you lift weights that actually challenge your muscles.
But how do we start without getting injured? Most of us have spent years or decades doing gentle exercises.
That's the right question. And here's something that'll shock you. People who've never exercised are in a better position than those who spent years doing the wrong types of exercise. Because people who've never worked out know they're weak. People doing useless exercises think they're strong, but they're not.
That's a disturbing revelation.
Yeah, but it's the truth. And the truth is, you can reverse decades of muscle loss in just a few months, but only if you stop wasting time on activities that don't work. Your muscles are waiting to be challenged. Your bones are begging for stress, but you need to give them what they need, not what feels comfortable.
And what if someone's already feeling the effects of that weakness? If they're already struggling to get up from a chair or climb stairs?
Then it's time to wake up and act with urgency. Every day spent doing the wrong exercises is one more day closer to total dependence. But here's the good news the medical industry doesn't want you to know. Even very frail people can regain strength quickly if they do the right things.
How quickly?
I had a 73-year-old patient who came to me needing to hold onto the wall just to get out of bed. She'd been doing water aerobics for 5 years, thinking she was taking care of herself. After 3 months of proper training, she was squatting more weight than some 30-year-olds. In 6 months, she was hiking mountains.
That sounds almost miraculous.
It's not a miracle. It's science. It's what happens when you stop fooling your body and start giving it the stimulus it actually needs. But it has to be the right stimulus, at the right intensity, with the right progression. Otherwise, you'll keep wasting years doing movements that just keep you busy while you get weaker.
But doctor, I need to be honest with our listeners. A lot of people are going to hear this and think, but my doctor told me intense exercise is dangerous at my age. How should they handle that contradiction?
That's a question that gets right to the heart of the problem. Most doctors were trained decades ago when knowledge about exercise and aging was primitive.
They were taught to fear intense exercise in older adults, but never taught to fear weakness. And weakness kills far more people than exercise ever will.
Can you quantify that?
I can. In the US, age-related muscle weakness kills more people annually than breast and prostate cancer combined. But those deaths don't show up in statistics as death by muscle weakness. They show up as falls, fractures, pneumonia, surgical complications. The root cause, muscle loss, is ignored.
That's a completely different perspective from what we're used to hearing.
And it's intentional. Because if people understood that weakness is the main cause of lost independence and early death in older adults, they'd stop accepting useless exercise programs. They'd start demanding real training. And that would threaten an entire industry built around dependence.
When you say real training, are you specifically talking about weightlifting?
Weightlifting is a crucial part, but it's not the only thing. I'm talking about any exercise that forces your body to adapt to stress. That includes weights, yes, but also body weight exercises that truly challenge your strength, balance exercises that push your limits, activities that make your bones work against gravity with intensity.
Can you give practical examples of what that means in daily life?
Sure, instead of casually walking on the treadmill while chatting, do intervals where you speed up until you're out of breath. Instead of lifting 1-pound weights 20 times, lift weights you can only manage 8 times and keep increasing over time. Instead of doing relaxing yoga, do exercises that require you to get up from the floor without using your hands, repeatedly.
And what about safety? I know many listeners are thinking about that right now.
Real safety comes from strength, not from avoiding effort. You know what the most dangerous exercise is for a 70-year-old? Trying to get up from a low chair when they don't have enough leg strength. That results in thousands of falls every day, but no one classifies sitting in a chair as a dangerous activity.
So you're saying that avoiding physical challenges actually creates more danger?
Exactly, and I have data to back that up. A study from the National Institute on Aging followed 15,000 people over 65 for 10 years. They split them into 3 groups: sedentary, light to moderate exercise, and supervised intense exercise. Guess which group had the fewest injuries and hospitalizations?
The intense exercise group.
Correct, and it wasn't even close. The intense exercise group had 60% fewer injuries than the sedentary group and 40% fewer than the moderate exercise group. Because when you're strong, you don't get hurt doing basic life activities. When you're weak, tying your shoes can throw out your back.
That really flips the whole risk and safety conversation on its head.
And it should. But there's massive institutional resistance to this shift. Hospitals, nursing homes, the pharmaceutical industry, they all profit when people become dependent early. There's no money in 80-year-olds who are independent and healthy.
You mentioned the pharmaceutical industry. How does it fit into this whole issue?
It's simple. A strong person doesn't need osteoporosis medication. They don't need joint pain meds. They don't need antidepressants because they're maintaining their independence and self-esteem. A weak person becomes a lifelong customer for multiple industries. And ineffective exercise routines guarantee that you'll gradually become weak without even realizing it.
So you're suggesting there's a financial interest in keeping people weak?
I'm not suggesting, I'm stating it outright. And the numbers are frightening. The elderly care industry generates over $400 billion a year in the US alone. Every person who stays independent until age 85, instead of becoming dependent at 70, represents tens of thousands of dollars in lost revenue for that industry.
That's disturbing to even think about.
It's disturbing, but it's the reality. And that's why information like what we're sharing today is so important. Because once you understand the game, you can choose not to play. You can choose to stay strong, independent, and live on your own terms until the end.
And for someone listening right now who wants to start today, what are the signs that an exercise is actually working?
First, you should feel your muscles working during the exercise. If you can do the movement without feeling that your muscles are being challenged, increase the intensity. Second, the next day, you should feel like you did something. Not extreme pain, but that sensation that your muscles worked. Third, you should see progress week after week. If you've been doing the same exercise with the same ease for months, you're wasting your time.
And how long does it take to see real results?
If you're doing the right things, you'll feel stronger in 2 weeks. You'll see changes in appearance in 4 weeks. You'll feel the difference in daily life in 6 weeks. But it has to be real exercise, not theater. Most people have been doing theater for years and wonder why they don't see results.
Doctor, I'm genuinely shocked by what we've uncovered today. The idea that millions of people are exercising just to get weaker it's terrifying. What would you say to someone listening right now, realizing they might be in that situation?
First, don't panic, but also don't ignore the signs. If you're over 50 and can't pass the basic test we mentioned today, getting up from a chair without using your hands, carrying groceries without extreme effort, climbing stairs without getting out of breath, your current exercise program is failing you.
And what would be the first practical step for someone who wants to get out of this trap?
Stop doing exercises that don't cause real muscle discomfort. That may sound contradictory to everything you've heard, but muscles only grow when they're forced to work. If you finish a workout feeling refreshed and energized, you didn't stimulate muscle growth, you just burned a few calories.
That goes against decades of conventional medical advice.
And that's exactly why we have an epidemic of frailty among older adults. Look, I'm not asking anyone to become a bodybuilder overnight. I'm asking people to stop accepting the lie that frailty is inevitable. 2 or 3 days a week of exercises that truly challenge your muscles can mean the difference between living independently into your 90s or needing care by 70.
But doctor, let's be practical here. Many of our listeners are probably thinking, okay, I get the problem, but where do I start? Because we know most gyms and personal trainers still follow this gentle approach for seniors.
That's exactly the question that keeps me up at night. Because you're right, most professionals are still stuck in the old paradigm. They see someone in their 60s and automatically assume fragility. They lower the weights, reduce the intensity, and turn the workout into a disguised physical therapy session.
So how do you identify a professional who really understands this?
Ask direct questions. Ask, do you believe people over 60 can and should lift heavy weights? If the answer is hesitant or full of warnings about taking it slow and being careful, find someone else. Ask, do you have 70-year-old clients who do full squats? If they don't, it's because they don't believe in the potential of older adults.
And for those who want to start on their own, is there a safe way to do that?
There is, but you have to be smart about it. Start with body weight exercises, full squats. Real squats, not those half bends they teach seniors. If you can do 15 full squats easily, add a weight. It can be a backpack with books, a water jug, whatever. The important thing is to keep progressing.
And what about joint issues? A lot of older adults have arthritis, knee problems.
Here's another lie we've been sold, that painful joints need rest. The truth is, painful joints need movement and stronger muscles around them. Weak muscles put extra stress on joints. Strong muscles protect them. I have patients with severe arthritis who became nearly symptom-free after proper strength training.
That's revolutionary compared to what we normally hear.
It's revolutionary because it challenges established interests. Every person who fixes joint pain with exercise is someone who won't buy anti-inflammatories for the rest of their life. Every person who maintains strong bones naturally is someone who won't need expensive osteoporosis drugs. You see the pattern?
I do, and it's scary. But let's talk about nutrition too. How does diet fit into this whole muscle loss issue?
Excellent question. Nutrition is the other half of the equation, and it's also being sabotaged. Protein is essential for muscle maintenance, especially after 50. But what's the common recommendation? Low protein diets, lots of carbs, very little fat. It's a recipe for accelerating muscle loss.
How much protein should someone over 50 be eating?
Way more than the official guidelines suggest. We're talking at least 1.2 grams per kilogram of body weight, and ideally closer to 1.6 grams. For a 70-kilo person, that's over 110 grams of protein per day. But most seniors consume less than half of that.
And why are the official guidelines so low?
Because they were designed to prevent deficiency, not to optimize health. It's the difference between surviving and thriving. The official guidelines want you to survive. I want you to thrive into your 90s, carrying your own groceries.
Do you have a specific example of how this difference in protein intake affects real life?
I do. I have a perfect case. 2 identical twin sisters, both 67. One followed a healthy diet recommended by her doctor. Low in protein, lots of whole grains, very little meat. The other ignored the advice and kept a high-protein diet. After 5 years, the difference was shocking. The first one needed a cane to walk. The second one was running marathons.
Identical twins with such different outcomes?
Same genetics, completely different nutritional choices. Protein is literally the building block of muscle. If you don't consume enough, your muscles can't maintain themselves, let alone grow. And here's what makes me the most angry. The weaker sister followed the medical recommendations to the letter. She did everything right according to the current system.
And for those listening right now, realizing they might not be getting enough protein, start tracking.
Seriously, for 1 week, write down everything you eat and calculate your protein intake. You'll be shocked at how far below the ideal you are. Then start increasing it gradually. More eggs at breakfast, more meat at lunch, more fish at dinner. Your muscles will thank you within weeks.
And what about vegetarians or people with dietary restrictions?
It's more challenging, but not impossible. Combining legumes with grains, quinoa, plant-based protein powders, tofu, tempeh. But I'll be honest, it's much harder to hit ideal protein targets without animal sources. And for people over 50 who already have reduced protein absorption, it can be a significant challenge.
Doctor, before we wrap up, do you have any specific message for family members who are listening and worrying about parents or spouses who might be in this situation?
Yes, stop being accomplices in your loved one's frailty. When you say, take it easy, don't push yourself, you don't need this at your age, you're pushing them toward dependence. Support challenges, celebrate strength milestones, question exercise programs that don't deliver results.
That might sound harsh to some people.
It might sound harsh, but it's real love. You know what's truly cruel? Watching someone you love lose their independence slowly when it could have been prevented. Seeing your parents become dependent at 75 when they could have been strong and active at 85, that's what's cruel.
And what's your message for healthcare professionals who might be listening?
Stop underestimating your older patients. Stop prescribing exercise programs that don't work just because they're safe. Start fearing weakness, not intense exercise. And most importantly, study the latest data. The science of exercise for older adults has changed dramatically in the last 10 years, but clinical practice is still decades behind.
And for those who want to stay updated on this newer information about exercise and aging,
Look for recent studies on sarcopenia, strength training for seniors, and the benefits of high-intensity exercise. Ignore articles that start with gentle exercises for seniors or safe workouts for older adults. Search for terms like strength optimization, sarcopenia reversal, supervised high-intensity training.
and for anyone listening who feels like it might already be too late,
It's never too late, but it's also never too early to start. Every day you delay proper training is another day closer to the wheelchair. Your muscles don't know how old you are, they only know whether they're being challenged or not. And here's my final warning. If you keep doing ineffective exercises thinking you're taking care of yourself, you're just postponing the inevitable collapse of your physical independence.
that's a strong and necessary message. Where can our listeners find reliable information on how to train properly?
The most important thing is to find professionals who understand that older adults aren't fragile people who need to be protected from exercise. They're people who need to be protected from weakness. Look for someone who talks about progressive overload, who isn't afraid to see you sweat, who understands that muscle discomfort is a sign of growth, not danger.
Any final words for our listeners?
Yes, stop accepting frailty as your destiny. Stop wasting time on exercises that just keep you busy. Your body was built to be strong until your last day, but only if you give it what it needs. And what it needs is not comfort, it's challenge. The choice is yours. Years of useless exercise leading to dependence, or months of proper training leading to strength. Choose wisely. Your independence depends on it.
Thank you, Doctor. And thanks to all our listeners for another episode. Remember, your strength is non-negotiable. See you next time.